So now we have the privilege of introducing our first guest speaker. I'm going to read her bio, but really she needs no introduction. Everybody knows Tara, admires Tara and the work that she's doing, and just an integral part of the process and the advocacy of saving lives. Her presentation is Advancing Harm Reduction Services and Outreach here in San Diego County. And as I mentioned, Tara really does not need an introduction, but I'd like to share her bio with all of you. She is the founder and the CEO of the Harm Reduction Coalition of San Diego, specializing in grassroots organizing and advocacy, and that is absolutely true. She has over 30 years of experience working with people who use drugs, especially people who inject drugs, those impacted by the justice systems, and those living with or at risk of HIV, and those engaged in the sex industry. She is skilled in brief interventions, motivated interviewing, case management, strategy of change theory, trauma-informed care, and person-centered approaches. She is competent in overseeing complex projects, facilitating large and small groups, developing and delivering various curriculums. She has over 20 years experience working with community partners and participates in brief gaps in services incorporating harm reduction and social and racial equality, anti-oppressive frameworks, and trauma-informed, resilient, focused, strength-based approaches. We are honored to have Tara with us today. And thank you, Tara, and we look forward to hearing your presentation.
It's an honor to be here today. I appreciate the opportunity to be at this table and to present the great work that we're doing and that all of you have been a part of in one way or another, whether it's the back end work, it's the change in policy, it's looking for different ways to save our folks. And so today's presentation is a result of a lot of hard work put together by all of you. Give me just a quick second here. Okay, can everybody see my screen? Marla?
Yes, we can see it. Thank you, Tara.
Yep. All right, so this is the Harm Reduction Coalition of San Diego, and we are kicking off the San Diego Overdose and Education Naloxone Distribution Project. Today, we're going to learn a little bit more about that. So this presentation today is brought to you by a collaborative partnership. This partnership has been long in the making, and it's been a collaborative endeavor with the County of San Diego in many fronts. The Harm Reduction Coalition of San Diego, A New Path, Say San Diego, and UCSD, as well as a number of community-based organizations that are already operating in the county. The Harm Reduction Coalition of San Diego itself provides harm reduction services all throughout the county of San Diego. Here's a brief look at our new and first time seen logo. So this will be the logo that will be on the vending machines. That at the center of your screen, it says San Diego Education and Naloxone Distribution, SDOEND, and the tree and lung at the bottom is our logo. We'll talk more about the vending machines in a minute. Oops, sorry. So the Harm Reduction Coalition of San Diego, let me tell you a little bit about us. We are a grassroots organization, a nonprofit, and we've been aimed at providing high quality and low barrier services. Some of those include naloxone distribution, overdose prevention and education, drug poisoning risk reduction through drug checking. We provide a lot of supplies such as fentanyl test strips, benzo test strips, a 9-panel reagent test kit, and we will be getting a FTIR drug checking machine shortly, and that'll be something we talk about in a minute as well. We do syringe disposal and syringe services. We are not a one-for-one syringe service program. We are a needs-based mobile syringe service program, and we operate through the entire county of San Diego and serve about 4,000 participants at this moment. And we also provide community referrals and linkages to healthcare, substance use treatment services, HIV, hepatitis C, homeless services, really whatever people need, we work to provide that for them. We really try to find out what their needs are, where they're not being met, and find ways to meet them. We also work to improve the existing system for community-wide distribution. We do this by partnering with a large number of community partners throughout the county through innovative and evidence-based strategies. And a good majority of those are really in alignment with the County of San Diego's comprehensive harm reduction strategy, which was approved by the Board of Supervisors last year in June. So opioid overdoses are a national and local crisis. I think all of us are on this call are aware. And in San Diego alone, we've seen rising opioid related deaths for several consecutive years. We've also, a number of consecutive years. We've also seen a raise in methamphetamine related deaths. And I think other folks on the call today will talk more about that. Naloxone itself is a life-saving medication that reverses overdose when it's administered to people who are currently experiencing an overdose. And because of these rising overdose rates in the region, the enhanced distribution of naloxone or Narcan into the hands of community members is vital. It's really the only way that we can ensure that the lives are saved that might otherwise be lost to overdose death rates. We look at the numbers from last year and they're astronomical in relation to other areas in the country. And we need to look at other ways to do this, and that's going to happen by saturating the community with naloxone. And it's been shown that for every for every 36 kits of naloxone in the high-risk population that are distributed, one life is saved, and about 200 kits distributed in the general population, we have a life saved for those. And so we're looking at being able to get a lot of naloxone into the hands of the community, and each one of those kits represents some lives that will be saved. So how do we address this naloxone distribution in order to affect a difference? We've done what we can up until this point to provide naloxone in every capacity that we could. It's been siloed in many ways. There's organizations that provide small amounts. There isn't a central location to find where naloxone is available. The county has been providing it for a little over a year through their standing order under Wilma Wooten. However, we don't have truly accessible naloxone to the entire community that's going to affect a difference. And so how do we do that? Several months ago, the County of San Diego issued a RFP, which is a request for proposal for an innovative naloxone distribution program contract. And with a number of people who've been doing this work for a long time in the county, we came together and developed a collaborative partnership with a number of organizations and borrowed upon California Health Project LA, which is the largest naloxone distribution project in the country in the United States. And last year they had gotten out over 50,000 kits. So we worked very closely with them to figure out a way to be able to affect a difference here in San Diego, which is important. We're a border region and we have a lot to consider. So we applied for the contract and were awarded it. And as a result, we are going to design and implement a naloxone distribution program. And we're in the process of it that integrates the community engagement, organizational partnership, training and education, the distribution of naloxone and other harm reduction resources, the tracking and evaluation and reporting strategies that will result in naloxone saturation throughout all the regions in the county. And this contract is in alignment with the County Board of Supervisors' comprehensive harm reduction strategy. And here's a little bit about that in case you weren't sure. It was approved by the County Board of Supervisors on June 8th of 2021. The comprehensive harm reduction strategy envisions a community where the impacts related to substance use are seen as a crisis that influences overall health, well-being, and the quality of life of the individual, families, and community, where stigma does not impede access to services, and where we are able to really realize a community free of the substance related harms. Those are not just individual, those are community related harms as well. So when we think about the impact of the harms caused by substance related issues, it really is a family matter, a community matter, and it's not just on an individual basis. And this strategy was really created based on a mission to protect San Diegans from the individual, the family, and the community impact of that drug use, which prioritize human dignity. It saves lives and provides appropriate levels of care for people who use drugs, and the best practices in addressing the substance use and addiction. If you've watched the news or paid attention to everything going on in the county, you'll see the large amount of programs and contracts and opportunities to do something different that are rolling out. And this is a direct result of the hard work that's gone behind not only the implementation of this strategy, but the long and hard work hours and dedication and commitment from a number of folks who have worked diligently to make this a reality. So the goals of the program of SDOE&D and the objectives, we aim to reduce the impact of substance use disorder and its conditions by implementing overdose prevention with people who use drugs, the service providers, and other community members who may be at risk, and those associated with people at risk. We will serve the population, including all county residents who are using drugs, as best as we can. We can't maybe find all the county residents who are using drugs, but our goal is to really find everybody that we can, with a special emphasis on those on opioids and those that are at a risk for overdose of opioids, and their families, their social networks, and other associates, along with any other member of the public who may be more likely to witness an overdose, along with service providers or community-based organizations that work with this population. This is a really exciting part of the presentation, and these are some of the innovative strategies that we have developed with the San Diego Overdose Education and Naloxone Distribution Program. The first and foremost, the strategies themselves and the development of the program have been driven by the voices of those most impacted. We have kept our finger on the pulse, continued to work with people who have experienced an overdose themselves, people who have lost loved ones to overdose, and people who are currently using. We really make sure that we use their voices to build the program so that it's not what we think they need, but what they tell us that they need. And part of that strategy is to be able to provide 550 naloxone and harm reduction trainings a year. That does not include the trainings and such that will go out to the population itself. These specific trainings will be to onboard and train community partners, law enforcement, probation, criminal justice partners, juvenile probation, non-traditional first responders, the youth and TAY population, educators and counselors, middle and high school students and their parents. It will be to train and onboard emergency rooms, jails, and outreach teams with homeless service providers. And we'll also be developing and providing comprehensive and very in-depth harm reduction training and technical assistance. The technical assistance we'll be providing looks like coming out into the field and seeing where there might be gaps in policy, procedure, in development or implementation of programs, and finding ways to take a deeper dive look at how to best support people with a new framework. And then we'll be providing naloxone access points. They'll be called NAPs throughout San Diego County, all the regions, 5 days a week. I believe it's 3 to 5 hours a day. So there'll be tables, whether those tables are in a storefront, whether they're inside of a community-based organization, whether they are at a designated site. They will be access points available 5 days a week for people to come and get low barrier naloxone, needs-based. There won't be a limit necessarily on the number that people are able to access. And then we are very excited to announce that we are going to be strategically placing 12 vending machines throughout the areas of the county with the greatest need. I can say that the first vending machine is slated to be placed and is already ordered. The technical stuff like the logo on the outside and things like that are still being finalized, but the machine itself is being readied now for us, and the first machine will be delivered at South Bay Regional Recovery Center with McAllister, and we are in the works of getting the final paperwork signed to get the second vending machine on Santa Isabel Fire Station. It'll be the first of its kind on tribal land in the United States. We have 4 other tribes ready to place vending machines, and a number of other community organizations such as Owens Clinic with UCSD, Father Joe's, Eldorado Community Clinic, McAllister's Lemon Grove, Detox in Kiva, their North County location, as well as their East County location, and a number of other providers. We will be using a vetting form so that we aren't just randomly placing vending machines. We're looking at the need in the community. We're looking at the availability of the machine access. We are looking at need in the community. We're looking at a lot of things, as well as overlapping them with maps from OD maps and other county data to be able to make sure we're hitting target areas in a way that's accessible for everybody. And one of the goals, not just through the vending machines themselves, I think the final diagram yesterday showed 180 kits would fit in each vending machine. So that will not be the only way we get them out. They'll be through naloxone access points and through community-based organizations who distribute schools, high schools, jails, all these things listed that will also be distributing kits in the community, as well as into the hands. Our primary goal is to get it into the hands of people most impacted, and that looks like a lot of work out on the streets, doing direct one-on-one handoffs of naloxone and street-based training. We also have an 800 number, or 888 number. It is 188 Narcan 0. And we are in the process of developing a centralized website, which will allow people to register for this program utilizing some very basic anonymous data that we're gathering for demographic purposes and evaluation. And then they will answer a few questions, watch a very quick training video, and then be given a PIN number. And that PIN number will be their number that they access, use at the machines to access naloxone. We will have several other ways to enroll people as well. We're looking at all of the ways that might be barriers for people and trying to find ways to eliminate them. And it's really important for us to make sure that that barrier access is really low. That's one of the most important things we've heard from people on the streets. And as a part of all of this, we are gathering data and evaluating it and sharing that data with county and other interested organizations who are working on the same capacity to address the increase in overdose deaths in the region. And we're also looking at the efficacy of some of these innovative strategies throughout the process. And we'll be able to really rely upon some of the data that's gathered to develop some research projects as well. So we have a lot of collaborations and partnerships, and they're the key to this program. Working very closely with stakeholders over the last 5 years, it really, the momentum began prior to the Eliminate Hepatitis C initiative, and people were looking for a way to try to facilitate a change in a lot of things occurring in the county. And one of the ways that we were pivotal in getting some attention and momentum was through the Eliminate Hepatitis C initiative. And we developed a close partnership with a number of stakeholders in the community. And from there, we've relied on those stakeholders and brought on a lot more. We've got workforce partnership stakeholders, we have treatment stakeholders, we have prevention folks, we have a number of people, including law enforcement, task force folks. And it's an amazing partnership. We sit on coalitions and participate in them. We work with task forces, treatment and homeless service providers, and those with lived experience, medical providers, law enforcement, our criminal justice partners, and community-based organizations to help build supportive and collaborative community. And this is the way that we're going to accomplish the goals that we've discussed here, and that is to save lives. Education and the shared ideas and innovative strategies have been the key in the development of this local response to the overdose crisis we face today. I sit on a lot of national calls and panels and platforms, and I have heard nothing but amazing things about this region from outside of this region, and how closely people are watching what we're doing, and how amazing it is that we have been able to take a space where we did not have a framework to support people as much as we do today. And we have been able to really increase the amount of awareness in the region, and people have come on board to try to do something different, and we're knowing better, and because we know better, we're doing better, and people are paying a close eye to us. We are on the border, where fentanyl floods through, and if we don't have a response, that's problematic. And so it's really exciting for all of us here today to be gathered and be part of that response. We've been able to establish partnerships as a result of these longstanding collaborations with HIDA, ODMAPS, researchers with UCSD, University of Victoria, British Columbia, and partners in Mexico and several other places around the country, with the County of San Diego itself. And the goal is to save lives and prevent overdose. And so much of this work is actually done by reducing the stigma and educating each other. And through these collaborative efforts, we've really been able to reduce the stigma amongst ourselves, and hopefully that's having a rippling effect in the community. It also starts with how we communicate with each other when we're not working and we're in the community, and how we change that languaging, and that's part of our thing. So how do we think outside the box and get this stuff done? Some of the things that hadn't been maybe recognized before, or being done, or just weren't current for a lot of folks, was bringing the ongoing engagement and listening sessions and inclusion of people who use drugs into the planning and implementation of programs and policies. We have a number of organizations across the county who have traditionally had abstinence-based only policies and procedures, and their programs themselves reflect that. Many of these hold county contracts, and many of these folks do a lot of the service providing. However, those very policies and things are what creates a barrier for folks who are accessing things. And so together over the last several years, really working with all these different organizations to bring folks to the table, to help them drive and lend a voice to how those policies roll out and affect people, and ways they might be able to make some changes there. We're looking at non-traditional settings. We're on the tribal reservations, we're having conversations about not only traditional placement, but having naloxone access point at the grandmother's homes, or some folks we're talking to in Southeast San Diego, having them at certain community member leaders' homes, different settings that we may not normally think about. Being able to provide services, naloxone, and access in non-traditional settings is going to be important in addressing the overdose crisis. Of course, first responders will show up to overdose events. We have law enforcement that shows up. We have community providers who provide the naloxone, but there's a gap in there in that non-traditional setting, and who is often that first responder, or how things get addressed. And so thinking outside the box and how we bring those folks to the table from non-traditional settings has been important. This is not part of the San Diego Overdose Education and Naloxone Distribution Project. However, the thinking outside the box with much of what we're doing includes drug checking. There is a new program called Check SD that we have developed in partnership with UCSD, the Harm Reduction Coalition of San Diego, the County of San Diego, and the Josh Gaffin Foundation, in order to be able to purchase an FTIR machine, it's an infrared spectrometer, which will be able to look at drug purity and potency. And we will be providing those drug checking services and evaluating the data as it pertains to folks' use, their habits, the drugs that we see on the streets, the combinations, what is actually in the drugs, and be able to talk to people about if they're still going to use, how that looks, and educate people on safer use. And that's something that we're doing with Check SD. Currently, we use a 9-panel reagent test kit along with fentanyl test strips and benzo diazepine test strips in order to help identify substances in the community. And through our partnerships with some of y'all on this call and the Narcotics Task Force Team 10 and HIDA and a lot of other folks, we've been able to check some other supplies that were problematic on the streets and get some more information. And we've got great feedback from people on the streets. That's one of the ways that we can think outside the box. We have thinking outside the box might look like drop-in centers, which could be lots of things, but a space that folks could drop in. Drug user health itself. Are there drug user health hubs where people can come in and get their hepatitis C taken care of, their HIV, they can receive naloxone? Do we have places to do secondary distribution? I talked about non-traditional settings, and can we get distribution into the hands of people that can get it into the hands of people who need it? And do we have credible messengers? I can't deliver a message necessarily in a population that may not be mine. And so we really work with our community partners to use and rely upon those credible messengers, not only to deliver the message, but also to help guide the work that we're doing so that we know more about the messages that they're carrying from their community. And we work together in a collaborative fashion. And then overdose prevention sites. And that's not something that we're looking at here in San Diego, but that's one of the ways that it's an option to look at outside the box for overdose prevention sites. Ongoing work to address the stigma is one of the big things. It's not really thinking outside the box in the context of addressing the stigma, but I'd like you all today, you'll take lots from everything, but taking a minute to look at our own personal biases and how we communicate with others in our personal life and in lots of other fashions. That really does begin to create the thread that will start to weave the change is when we practice it in our own lives, and looking at where those biases may lay and how we can work to change that narrative in all the areas of our lives really helps to create a sustainable movement for the capital H, capital R harm reduction movement itself. And leaning into evidence-based interventions that are used not only locally or nationally, but around the world. In the United States, we are far behind a lot of other countries when it comes to research around safe consumption sites, because we don't have them so too much in the United States, minus On Point in New York and an underground safe consumption site in San Francisco that most of the evidence in the US has been built around. But looking at the efficacy of those and the fact that there are programs around the world with very low rates of overdose, and there are countries around the world with much lower rates of overdose, and how do they get to that point, and leaning into the way that they develop programs to address those things, bringing experts in to give a different viewpoint of what we're doing, because they may have solutions we haven't thought of. So thinking about ways that we can do this. And that is my presentation. I want to thank you very much. This is my information here. I will also drop it in the chat. Please feel free to reach out to me if you have a community-based organization or yourself who's interested in training. You want to know more about the project or any of our services. And I will also leave my personal phone number if you would like to reach me. And I just want to say thank you for this honor, and I will turn it back over. Thank you.
Thank you, Tara. First, thank you for the work that you're doing. You are saving lives, and really appreciate this new contract and the work you're going to be doing. The low barrier access, 33,000 plus kits out there. I mean, talk about ambitious. Being able to do trainings within our ERs, our jails, our outreach teams, our non-conventional outreach teams. So thinking outside the box. Vending machines, absolutely needed and necessary. So thank you. We do have a couple questions. Is the 888 Narcan Zero number live? Can it start to be used and distributed?
It is live. However, the platform that we use for it is having a maintenance period for the next 2 weeks. So we are not able to utilize it I think if you call it a ring to me, I'm not sure because I haven't been getting calls for the last couple of days and we're working to address it, but it is live. It does work. It's printed on our stuff. It is listed on 211. We're accessible through 211. And that's why I also want to give my personal number so that if people do need access prior to that, I can make sure that I can get some naloxone out to the community in the meantime.
Okay, thank you, Tara. And
Mhm.
another question from one of our participants, with this new contract and the great work you'll be doing, what is the evaluation process, the data you'll be collecting? I mean, obviously, we're going to be able to see if we have fewer overdose deaths, but
Right.
what are some other indicators or data you're going to be collecting to be able to demonstrate the success that we all know you will have?
That exact evaluation questions are in the process of being finalized through UCSD and the county and ourselves. But some of the questions include how have they ever had a prior overdose? How many times have they overdosed? Have they witnessed an overdose? Have they responded to an overdose? If they have responded to an overdose, was it successful? If it was not, why not? So we really wanted, that's a question we really want to know. If you responded to an overdose and it was not successful, if you administered Narcan and it wasn't successful, why? Did you not have enough Narcan? Was there something else going on? We're looking at that stuff. We hear a lot of things from different people, and we're looking at the drugs that they're using. I don't know the exact evaluation questions. They're not questions that'll be asked of everybody in the program. We have a target population, a control number of people that will doing those evaluative questions from. However, we will be taking the data from the vending machines and the sites and being able to do that. We can pull real-time data from the vending machines to be able to see how much naloxone people are accessing and where. We can track where a certain person might access in different areas. We can track a lot of things. And if you have ideas about what you might want tracked or what would be helpful to be tracked, please let me know, because we are in that process. We're looking at a lot of things in the county right now. If you think about the development of syringe service programs, the OD maps, the Fentanyl Toolkit, we have a lot of folks looking at information and trying to be able to develop services that meet those needs. And we don't want to duplicate data gathering. We don't want to flood the community with bunches of questions. So trying to be able to do it in a central location makes it easier for a lot of us. So if you have things that you might want looked at or curious about, please let us know. That isn't approved yet, and it is going to go in front of the IRB, the Internal Review Board for UCSD, in the next several weeks. So we do need those questions or ponderings sooner rather than later. But if you do have a question, but we will be looking at basic demographic data, trends in age and area of use, and the type of drugs reported. And the way that we're building the data evaluation and the people doing the data evaluation are also doing our drug checking evaluation. And we're building that platform to be able to layer over this one so that we are able to look at some of the drug use trends at a closer look, and how overdose prevention can be done in other ways as well.
Oh, thank you. Some additional questions are coming in. I'm going to ask just a couple more because I want to make sure we allow enough time for our next presenters. But obviously, those attending this training are very interested in your presentation. So thank you, Tara. How many naloxones will be in each vending machine?
So the schematics that we currently have, there's a meeting at 10:30 this morning to finalize it, but the schematics right now show 180 kits, which is 360 doses in each vending machine. The vending machines are also being outfitted, but not yet stocked for fentanyl test strips. So there will be a side panel, and I don't know the number yet on the amount of test strips we'll be able to fit when that happens. That's not occurring immediately, but when the access to the fentanyl test strips through the vending machines occurs, they'll be accessible through the vending machines. But 180 kits, 360 doses, and we will be filling them as needed. So we get a ding when there's an amount, and if it's every day, if it's, we don't know how long it will take for them to empty. So we will be able to keep them full.
Wonderful. And then will there be a PIN number for the vending machine for reusable by the same person for additional naloxone or Narcan?
Yes, so the machines, I think we're going to target them at 3 kits max per incident, because most of you know that the fentanyl and other drug supply on the street today, that 1 kit may not be sufficient to save a life. And or you might just not have 1 person you need to use it on. And so being able to increase that access a little bit, the vending machine sites will also have hard Narcan behind their desk, so that if there's any reason that people cannot access the machine, they will be able to still walk away with naloxone. But they will be able to access, if they wanted to drive around the county and access 12 machines in one day, they could. And if they need that much naloxone, there's a need for it. And so our goal is to make sure that 1 PIN code. So my name's Tara. My PIN code would be whatever, say it's 1, 2, 3, 4, 5, 6, 7, 8. That's going to be my PIN code ongoing. And if I forget it, we have a way to go. We will have a way to go and search for your PIN code. Each machine will also have a MasterCard at the site location, so that a staff member there can swipe a MasterCard to like a master swipe card to access the machine if somebody has a barrier to registering, or the machine's not working or whatever. So we're looking at all those things and making sure that it's easy for people, and there's no requirement to show ID for the registration. And we really want people to feel safe in accessing things. So the information we ask is their first and third letter of their first name, first and third letter of their last name, and their birth date. I don't care if they use Mickey Mouse, as long as they always use Mickey Mouse, so that I can count them as a unique person throughout the whole project. And we know there's, those little small percentages that we'll have to account for, but I think we're working with people who've been doing this for a long time in terms of evaluation and that sort of thing. So I'm hopeful that all those kinks are worked out.
Well, thank you, Tara. And we have a final question, but I think it's a partnership that our PDATF Safe Disposal Committee can work with you on. And as you know, we worked with the county something several years ago through the vision and innovation of Nick Machione. Instead of having a flyer of where our safe disposal locations are, we now have an interactive map that is a web-based interactive map. And I think it would be a perfect opportunity to also identify these vending machines on that interactive map. So great question. And again, it demonstrates the partnerships of all our agencies collectively working for the common goals. So can't thank you enough, Tara, for your presentation. As
Thank
always,
you so much.
You're amazing. And San Diego County is lucky to have you. So
thank you. I'm lucky to have the county. Thank you.
we now have the privilege of Cindy and Chastity sharing the Fentanyl Toolkit and the additional resources that you can now find on the PDATF website. So Cindy.
Thank you, Marla. I'm really pleased that Chastity is co-presenting with me today. I think many of you know Chastity as the person who is our IT specialist and our organizer, our content creator, our administrator, but really she's also a bilingual, knowledgeable, articulate presenter. And so it's really wonderful to see her step up in the presentation role. She presents often to different groups and to school children and youth throughout the county. And it's just really gratifying to see her have the opportunity to present to PDATF. Chastity really has been the driving force behind this toolkit. The idea initially started hearing from Amy Hendel, who put us in touch with the speaker at our last summit from the Arizona HIDA, and looking at their toolkit and realizing, how do we not have this here in San Diego? Next slide, Chastity. And there are a number of different groups that helped us make this happen, that provided materials for the toolkit, that helped brainstorm with us about the toolkit. but really I would say the majority of this work, I took kind of the 50,000 foot view of this, and the majority of the work really was done by Chastity. She was the driving force in looking at every single aspect of the Arizona kit and helping us customize it. And also Marla. I mean, Marla really looked into just quality assurance, just overall real hands-on direction for this project. And finally, Sarah, who put it all online and made it all work for us in a way that we hope will really stand out on the website and be very useful for everyone. All right, Chastity, if you could just introduce yourself briefly so that people can see you. Okay, you're on mute, Chastity.
Sorry. Good morning. My name is Chastity Diaz. I'm with the U.S. Attorney's Office, and I serve as part of the community outreach team and law enforcement coordinator with Cindy. And although I can't see you, I know I worked with many of you, and I continue to look forward to working with you. And I hope this Fentanyl Toolkit will be a useful resource for everyone.
Thank you. So our goal with this presentation this morning, we can't possibly go through every aspect of the toolkit. So we're just trying to give you an overview and just to talk a little bit about what the toolkit is for. I recently spoke with a group of youth at Westview High School, and I asked the youth, how many of you are aware of counterfeit fentanyl pills and the danger they pose? I want to say this is a class of about 50. And half of that class raised their hands. And I think that that's a tribute to the work that so many of you are doing, that Rocky's doing in the schools, and Kelly McKay, and the various folks who are going out with the juvenile smuggling team and also talking about fentanyl. And I know that many of you are separately getting into schools, your organization is, and basically spreading the word about the dangers of fentanyl. So the idea of this toolkit is that all of you and all of the people you talk to and the parent groups and the PTAs and the Rotary clubs will have access to this information, and they can take it and they can become presenters and they can become messengers to their communities. All of the information is there. It's there with notes, and it's basically designed to enable anyone, even someone without a lot of knowledge about fentanyl, to be a messenger about fentanyl. So our goal today is not to go through every aspect, but to give you a quick overview of the toolkit. And so when you initially see the toolkit, you're going to see a couple different areas, some warning posters, a toolkit for community and parents on fentanyl, specifically on Snapchat, because that's where a lot of kids are getting their drugs. And Chastity is going to be talking more about that in a moment. Toolkit on testing and hospital settings, and also a naloxone toolkit. And there, in addition, are a number of resources on there that we've collected from a variety of sources that I think could be super helpful. So this is a list of all the additional resources and information. There are videos, there's information on what parents need to know. There's information that's customized for schools, for older adults, for practitioners and families, behavioral health folks, and also a lot of information about social media, the Good Samaritan laws. We're going to be doing a really quick overview of some of these areas just to give you a flavor for what's in the toolkit and how you might be using it in the future. Next slide. So starting with the community and parent fentanyl toolkit. As I mentioned, this is designed so that anyone in the community and parents and parent groups can access this information for their own education, but also share this information. And so we tried to make it sufficiently detailed so that people can basically learn from looking at the presentation and be in a position to actually provide the presentation. Next slide. So this is what it looks like, and I'm going to turn it over to Chastity to talk about the process of creating this in a Spanish language version as well.
So all of our toolkits are both in English and Spanish. So if you have an audience that does not speak English and you need to do it in Spanish, you can also download that Spanish version. And we really tried to get something that was, as we know, we're a border state, and Spanish it's very different than English, and trying to translate everything verbatim is a little challenging because the meaning doesn't come across as it should. So I worked very closely with our interpreters unit at the U.S. Attorney's Office to really we wanted to make sure we got the same message across as we are in English. So we spent plenty of time putting this together and really getting the appropriate language to get the message across. As we all know, language really matters, and we wanted to make sure we got that message across also in Spanish. So all of our toolkits, and I will be showing you at the end, you can download either the English version or the Spanish version for that. In addition to it being in Spanish, all of the toolkits have a pre and post survey. So when you go out to the community and give these presentations, we highly encourage you to take a couple minutes to ask your audience to take these surveys. There are only a few questions, they're very short, but as we all know, data is very important, and we want to make sure that that the toolkits are providing the information and that the community is leaving with useful information. So, and all of the surveys are also both in Spanish and English. And I'll turn it back over to Cindy.
So the program basically starts with an overview of fentanyl, what it is, how big the problem is, basically what we can do together to counter the fentanyl problem. And some of you may have seen in the news recently, we released information last week that shows that fentanyl is really we are really the epicenter for fentanyl trafficking in the country. 62% of the fentanyl coming in from Mexico is coming through San Diego. And that makes it particularly important for us to arm our community with this information. And as you can see from the notes, basically all the information for every single slide is included in the notes, so that if you are going out as a presenter, if you have questions, you can always call us and we can give you more information. But we made a great effort to make sure that all the information you need to communicate each slide is in the notes. What we've tried to do with the slides is not to make them text heavy. What we found in research is that slides with pictures where you're talking to people, the picture is sort of sending the message and you're sending the message verbally, and that is more powerful than text slides. You'll see there are not very many text slides. We've tried to avoid that. In some cases, there are certain situations where we have used a number of text slides, but we really have work to avoid that and try to come up with compelling images. And that's why we've made the notes very detailed. Next slide. So we recently chatted with our folks at DEA, the special agents who really work on this issue, and we've made an effort to get every single name for fentanyl out there on the street. And so arming you with that information, you now have the command street names for fentanyl. Next slide. Basically, one of the major goals of this presentation is to ensure that kids are aware of the fentanyl pill, the counterfeit pill epidemic. And that's really where this started in Arizona. They had something like 14 kids who were in high school who died within a week due to counterfeit pills. And so we have modified and customized their fentanyl poster on counterfeit pills for San Diego. And there are a lot of materials in this presentation designed to help kids understand and parents understand the dangers of counterfeit pills. Next slide. So this is a game we play frequently. It was put together by DEA. Can you spot the real thing? And basically it's designed to show kids it's really difficult to tell a fake pill from a real pill. And we start out with, can you tell the real Beyonce from the fake Beyonce? And then we move on. Can you tell the real Nike from the fake Nike? I always get these wrong, by the way. Can you tell the real Percocet from the fake? And this is a great way to do an interactive presentation and to get the kids involved, and they really enjoy this. Can you tell the real Xanax from the fake? We're now hearing that also there are fake Adderall pills out there that are loaded only with meth. So this is another reason why the synergy of bringing PDATF and MSF together really does make sense. Can you spot the real thing? And lastly, can you spot the real thing? It is a trick question because they're both fake And the idea is to really get across to the kids that there's just no way to tell, that every time you take one of these pills, you're playing Russian roulette. I saw yesterday, Rocky posted on Facebook a huge seizure of counterfeit pills that came in from Nogales, and they're all colored. I mean, they basically look like those little Smarty candies you used to see. They're not just blue anymore. They still say M30, but they're in a variety of colors to look like candy. So this is a frightening trend, and we hope the information in the toolkit will help us counter it. Next slide. So we're trying to emphasize not just knowledge, the knowledge we need for prevention, but also intervention and treatment, harm reduction, how to get help. All of that information is included. So that we're really taking a 360-degree approach to the problem and not just focusing on don't do drugs. Next. One of the main goals also of the program is to really emphasize the importance of calling 911. And Bill Purnell was very kind to share SAY's slides in this regard. What we found is that in interviews that they've conducted with juveniles involved in the criminal justice system, pretty much all of them said that they would not call 911. They would be too afraid of law enforcement to call 911. So we are trying to emphasize in the toolkit the importance of calling 911 and the fact that the Good Samaritan law protects you from simple drug and possession charges. So merely doing drugs and being in the presence of someone who is overdosing is not going to get you in trouble. Next. So what can parents and caregivers do? We are really encouraging parents to talk to their kids about fentanyl. In addition to the fentanyl toolkit, I have a presentation on the top 10 things parents should know to talk to their kids about fentanyl, and that will be available on the toolkit soon. If you need it sooner than that, then please contact me and reach out. There are times when the entire toolkit to run through this presentation takes probably an hour, maybe longer with questions. The 10 things to talk to parents about is basically a 10 to 15 minute presentation. And so if you only have a short period of time, you may want to look at that presentation. But the idea is to get parents and kids talking. And we also encourage them to establish a rescue plan. So if a teen is at a party, for example, where someone's passing around pills, that they can text their parents a simple, for example, the letter X, and the parent will know to call the child and say, you need to come home right away. Something's happened in the family. I need to pick you up, to basically give the child an escape route. Next. Another really important aspect of this is the drug emoji codes. So when kids are buying drugs, they're buying it from a menu on Snapchat that often basically is totally coded with these emojis. And it's important for parents to be able to recognize that and to be able to have access to their kids' phones and their passwords, and to be able to look for this kind of information on phones to know whether their kids are staying safe. It's a part of keeping kids safe on the internet. Another resource, which I think is a really fascinating resource, is basically a trailer, a virtual tour of a room. It's called the trailer, the Rally trailer. And basically what it does is it takes the parents through every single place a kid might be hiding drugs. And if you've ever been to the National Drug Summit, Partnership for Drug-Free Youth.org would have this as an actual exhibit you would walk through. It's really powerful. And I could only find maybe 3 of the 10 places that kids could hide drugs. So now it's been converted to virtual form, and it's a great tool for parents. Next. So words matter. An important aspect of the toolkit and an aspect of everything we're doing that Tara underscored and that I also want to underscore is the importance of eliminating stigma. This can happen, and in fact is happening to everyone. It doesn't matter who you are, what community you live in. We are all affected by substance use disorder, and we're all affected by kids recreationally using drugs without any idea that they're using fentanyl and being at risk from their very first time, risking death from using drugs. So it's really important to use the right language. Words do matter, and avoiding words like dirty and addict and clean, former addict, abuse as opposed to use and misuse. All of those words really do matter. And I think that law enforcement has come a long way and really changing its language. And it's important to communicate this whenever we're communicating with the community, to use the correct language and to emphasize the importance of avoiding stigma. So there are stigma resources on the website, and we will be adding those specifically to the toolkit. So you can share those as part of this. And now I'm going to turn it over to Chastity, who's really familiar with Snapchat. I think I tried using it maybe once, so I have to admit to being not as educated as I should be about Snapchat. And it's pretty detailed and intricate the way it works. It is important for parents to know about Snapchat because it is where the drugs are being sold. It's also where we're seeing kids are getting recruited oftentimes on Snapchat to be recruiters for or to be smugglers for the cartels and to bring drugs across the border. It's very much an important tool that we need to know about and we need to be educated on. So Chastity, take it away.
So as we all know, Snapchat has become a very popular platform, especially for the younger kids, teenagers, high school students. And although we have a variety of different platforms, I feel like Snapchat is mostly used for the younger kids, and some of the other platforms are used for in general, basically by everyone. And like Cindy mentioned, we've been seeing a trend of youth getting drugs through Snapchat and or being recruited to smuggle drugs or sell drugs or be part of this vicious cycle. So this presentation is just, this toolkit actually is designed to give parents an overview. If parents have no knowledge or very little knowledge of Snapchat and how it works, this toolkit is designed to give them just an overview of what Snapchat is, the functionalities and things they should be aware of, or conversations they should have with their children. And I will share this video, and it's a video of a parent who lost their child to an overdose, and it was the child, it's believed that the child obtained these drugs through the platform of Snapchat.
This popular TV doctor and her husband are speaking out about the heartbreaking loss of their young son. They spoke with Amber Cogliano.
This famous relationship expert is living every parent's worst nightmare after losing her teen son to an accidental drug overdose.
It's the worst thing that could ever possibly happen.
Dr. Laura Berman has been a TV personality for more than a decade and hosts In the Bedroom on Oprah Winfrey's network. The mother of three and her husband Samuel Chapman say their 16-year-old son Sammy died after taking Xanax or possibly Percocet laced with fentanyl.
I was on my way up to his room when I found him because he had asked me to help him with an internship he wanted to do over the summer, and I was going up to discuss it with him when I found him.
They say Sammy was a straight-A student getting ready for college, and it was a case of experimentation gone bad.
I think boredom and tons of hormones and a feeling of immortality that all teenagers share, and a desire to push the limits and experiment a little bit, was what he was trying to do.
The heartbroken family believes their son purchased the drugs from someone he met on the social media app Snapchat, which allows private messages to be deleted immediately after reading them, which could make it difficult to find out what really happened.
We spoke to his best friend who was in the know and actually had a screen grab from the menu that the dealer had put out on Snapchat for the kids.
Snapchat, which boasts over 200 million daily users, says the company is heartbroken by his passing and is committed to working together with law enforcement because it has a zero tolerance for using Snapchat to buy or sell illegal drugs. Despite her grief, Dr. Berman says she is choosing to speak out in hopes their tragedy can save other children.
All I can hope is that parents can use our son as a teachable moment. He had so many dreams and so many plans that won't be fulfilled.
During the pandemic, 81,000 people died of overdoses in just 12 months, the highest number ever recorded.
So unfortunately, that is one of the scary things, right? These young people are using these platforms to purchase these drugs. And unfortunately, now it's just a click away, a message away, which is the most scariest of all. So for those that are not familiar, this toolkit talks about what is Snapchat. And Snapchat is very similar to some of the other platforms you guys might be aware, where you can upload messages, photos, videos, you can connect with friends, and it's all of the messages that you sent are called snaps. And just to give you an overview, there's different things you can do on Snapchat, like snap filters. And you might have seen these, where you can do bunny ears or just add different images to the photos. You can send videos, you can make calls, you can exchange messages. You also can do, if you do what's happening now, it gives you an overview of things that are happening, maybe artists, what's going on, news, things that are trending around the world. And then the Snap Map is basically you can follow all of your friends and know what your friends are doing and what's happening. And I will talk a little bit more about that in just a second. So a Snap Map is basically you can, let's say your friend's not responding to you and you want to know where they are. Through Snapchat, you can easily follow your friend and just type in their name and see where they're doing. Or you can even just go through using Snap Map, you can follow people that you might not be friends with. And so I'm going to give you guys an overview of a Snap Map that we just downloaded. So basically, this is a quick screen grab that, people can easily see what's happening around them without even knowing. You don't have to be friends with that person. So Snapchat allows for young people or anyone that's using this platform to see what others are doing, and you don't necessarily have to be friends with that individual. And then it's based on the colors, you can see how much activity is happening around you. So there's a lot of information that the young people might not be familiar that they're posting out on the internet. And then just to give you guys, give a basic overview to anyone that's giving this presentation, it talks about how easy it is to snap a photo. This is outside the federal building. You can easily snap a photo and then you can share it with friends. You can deliver it, share it on your snaps. But one of the misconceptions is that, this, once you put something, it disappears right away. But you can, easily do a screen grab or things like that. So for many youth that are using this, they feel like if they're using Snapchat, they're safe because it disappears within 1 second after somebody views their snap. But, that's one of the many misconceptions about Snapchat. And then this is not an issue that's just affecting us here in San Diego. It's an issue that's affecting everyone in the United States. And, the presentation gives an overview of how this is impacting everyone. But in some positive light, Snapchat is trying to, keep this at a minimum. They're working hard to eliminate the drug sales that are happening through their platform. So hopefully we'll begin to see more changes. But this is just, like I said, once again, a presentation to give parents an overview. And then it also talks about, talking to your children about being safe online, reporting any kind of criminal activity that you see, or making sure that your GPS capabilities are not public, or what they call the ghost mode, which prevents others from seeing or finding your location. So just talking to your youth about being safe online. And then I'm going to turn it over back to Cindy again.
Another very important aspect of the toolkit is to provide information on naloxone. I'm so impressed by all the work that Tara is doing. I think our thinking is really outside of the box and creative and really just digging down into each community. There are still, I'm sure, a lot of folks out there who don't know where to get naloxone, and probably some youth who are afraid to ask for it. and don't have any idea where to research, how to research where to get it, and don't think that they would be eligible to obtain it. So I think it's important for us to understand not just where to get naloxone, but how to use it and how to recognize the signs of an overdose. So that's part of what this particular aspect of the toolkit, the naloxone toolkit, does. So signs of an overdose, these are really important for kids to know. Many times people will say, I thought my friend was just sleeping. If the child is snoring or gurgling, hard to wake up, they think they took a little too much and they're sleeping. But in fact, certain sounds that are made, snoring and gurgling, really do signal that that person is in respiratory distress. And so this presentation is designed to help people recognize when somebody does need to be administered naloxone, that you have to try to wake the person up, try to stimulate the person, and if you're unable to do so, that you need to administer naloxone. Check to see if they're breathing, look, listen, and feel. Next slide. And to call 911. So this does go through naloxone use. It's very easy to use, as many of you who have been trained know. And individuals who get naloxone generally get training before or with the obtaining of naloxone. But this provides just, if you need a little refresher, maybe you've had naloxone sitting around your house for a while, you need a little refresher, this provides a little bit of information. Very easy to use. And finally, as part of the naloxone toolkit, we do emphasize the importance of calling 911. It's important for people when they're administered naloxone to also be hospitalized and to have that 911 assistance, because oftentimes a dose can wear off and they can pass out again and become unconscious again. They may need another dose. They may need more than you have on hand. So to save that person's life, calling 911 is just as important as administering naloxone. And we enlisted the help of Chief Roxana Kennedy, Chula Vista PD chief, to basically send the word that the Good Samaritan law does protect you. And if you happen to be with somebody who's using and they need to be revived and they need 911, call 911. We'll go ahead and play that short video.
Hi, I'm Roxana Kennedy, Chief of Police for the Chula Vista Police Department, and I'm here to ask for your help by saving lives during this opioid crisis. Individuals who have overdosed are being left to die because those around them are afraid to call for help. California's Good Samaritan law protects those who call 911 when they are present during an overdose. On behalf of law enforcement, please make that emergency call. You plus naloxone are a combination that will save lives in San Diego County, and you have the ability to make a difference. Thank you.
You know, at some point, I would love to add to that and actually have someone who experienced that situation, called 911 and, you know, did not get in trouble and was protected by the Good Samaritan law to really make that peer messaging. But I think that, you know, at least getting that point across from someone in law enforcement is a wonderful tool to have. So where are the toolkits located? And Chassie will start from here.
So all of the toolkits are located at the San Diego PDATF website. And I'm just going to give you guys a quick overview of how to find them. So currently, if you go to the website, you will get this pop-up message that shows you the toolkit, and it will take you directly to the toolkit. So like I said, it will pop up. You can click to toolkit and it will take you there, or you can view the rest of the website. But let's say for some reason the pop-up didn't come up, or you're just you're looking for something else. You can go to the top where it says toolkits, and you will be able to get to the toolkit. So this page will come up on your screen where you can see all the toolkits. So you can see the community parent toolkit, you can see the Snapchat, and just by clicking on these boxes, it will take you to this page. So once on this page, you'll see that it says English and Spanish. By clicking on the hyperlink, you'll be able to download each toolkit and save it to your computer. And then in addition, we have, if you continue to scroll down on that page, you will see all of the resources. So the video that we just showed, the Good Samaritan video, any handouts, any flyers or anything like that that you need or that is part of the toolkit, you can just simply scroll down and click on any of these links, and it will take you to it will allow you to download or view the specific document. So everything that you need is just a click away for you to download and begin using. And if for any reason you have any questions or are having trouble accessing any of the documents, just please email PDATF, and they will make sure to, if there's an issue, resolve the issue or help you get to what you're looking for.